The screening tool is just unbelievably simple. 2 questions about cigarettes and alcohol before you knew you were pregnant. And so in the 4 years from 2003 to 2007, almost 7,000 women were asked those questions, and about 16% of them actually answered positively that they had a cigarette or had some alcohol in the month before they knew they were pregnant. Positive screen. The question is, well, is this screen, is it valid? Is it really identifying women that are high risk for continuing to use something? Of the 16%, you can see how many were taking tobacco, alcohol, or both. Again, it was 16%, 1 out of 6. Then they underwent an assessment, just how much are you taking, when, and what are you taking? So of the women who were screening positive, this is over the 4-year period, over 40% of them continued to use alcohol or an illegal drug after they knew they were pregnant. This is another way of looking at alcohol being the primary substance that they continue to use in 37% of the cases. 6% use marijuana, and 5% use another illegal drug, and that is primarily methamphetamine here in Ventura. This is data from this year, and it's interesting that the data is shifting a little bit. Done over 1,000 screens, and now our positive screen rate is rising a little bit. One of the factors that we've realized is important has to do with the staff who are actually asking the questions. And there's a whole art in asking the question and getting a woman to be honest. And with more skill in interviewing a patient, you're getting more honest answers. So about 1 out of 5 screening positive, and over half of them are continuing to use something. That rate has now gone up. It's now 57% of those who are screen positive. So the screen rate's going up, and those who are actually continuing to use is going up. So this whole tool is improving. The skill level at the clinic is improving. Now, when women come in for their prenatal care, there are certain diseases that are just routinely screened for. You want to know what their blood pressure is. You want to know what their urine looks like to see if they have gestational diabetes. And if you look at the prevalence rate for those diseases, this exceeds them as a disease. If a pregnant woman did not have the blood pressure checked, you wouldn't ignore it. You'd ask your nurse, I need to know what the blood pressure is for this patient. Same thing needs to happen with this screening result. As you heard, this is an umbrella term that describes a range of challenges, and it's a rather broad range. This slide shows about a study that was done up in Canada where they went into a juvenile justice setting and they underwent a forensic psychiatric evaluation. About 1 out of 4 of those adolescents actually were given a diagnosis of what they called a fetal alcohol effect. Again, given the challenges with impulse control and judgment and understanding cause and effect, it's not surprising that these teenagers get into some problems. There was a survey that was taken, I guess in 2004, was published in Addiction Biology. So the survey was every state, 4 major cities, representing over 3 million inmates. And they had almost 80% respond to the survey, and basically wanted to know, well, how many of your inmates had actually been screened and diagnosed with a fetal alcohol related disorder, and we had 1 in the United States. So we're not quite there yet in recognizing the impact this has on our society. I think we're a little too focused on just punishment. And this is the message that we all need to be telling them, that there is no proven safe amount. We don't want people who have a child with a disability, who had an occasional drink, to feel that they are at fault. So I wouldn't be having this discussion with them. But I think it's important when you see women who are pregnant to tell them that we don't know how much safe, and that you're taking a risk if you want to drink alcohol during your pregnancy. And there is a program we have here we call the I Am Concerned program, and it talks about the art of talking with somebody. I am concerned that you're continuing to use alcohol. We know what alcohol can do to your developing baby, and I really encourage you to stop.